Thank you for joining us. I'm Marshall Stewart, UM System Chief Engagement Officer and MU Vice Chancellor of Extension and Engagement. I'll be your moderator today for today's town hall with our retirees. I'd like to thank our panelists and many others who have worked so hard to put this particular town hall on for our campus and our system retirees. A few quick notes before we get started. There have been some questions about our retiree address list. And I think it's important for all of us to know that sometimes we fall behind in getting those updated. And so what we want you to do is to help us with that. We want to make sure that we have your preferred email and not perhaps one that was with you when you were an active employee within the University of Missouri system. So what we need you to do is, if you haven't updated that, is to go to myhr.umsystem.edu. Again, that's myhr.umsystem.edu. There you'll find a pathway to go forward and to make sure that's updated. So we hope you'll do that with us. That'll help us communicate with you better in a timely way in the future. Now, as I want us to talk about today's town hall and how it will work. First of all, many of you have been very kind in submitting a lot of questions to us, and we've gone through those to make sure that we have hopefully a good understanding of the issues that you're interested in. We'll also be taking some questions live as we go through this discussion today. But because there were so many questions that were similar, we've taken those and combined those to hopefully give you the answers you want in a timely way and in the right way that you're interested in. In the interest of time, we've kept our Q&A portion today on the most relevant questions, and again, those things that really center on the current issue at hand, which is COVID-19. Our team has reviewed those questions, and we've made sure that, again, if there's questions that we couldn't get to today, either through the live portion of the program or maybe something you sent in earlier, we're going to have those questions answered for you online following this particular event today. So again, be looking for information from us in terms of how to get the full recording and also answers to your questions online. We want to make sure, again, that we communicate well with you and that you have the information you're looking for to make decisions that you may be interested in terms of your own well-being. So now let's get the show started. Before we jump into your questions, though, I want to cede the floor to our president and MU Interim Chancellor, Moon Choi, to say a few words. President Choi?
Thank you, Marshall. And also, I hope that all of you are doing well. We've been thinking about you, like we're thinking about our students, faculty, and staff, and wish you the best of health during this unprecedented period that we're facing. I also miss having those meetings with the Retirees Council, but we're going to be resuming that once we get back to normal operation. Today, I want to provide you with a brief update. As many of you know, we are facing, as a university, challenges like we've never faced before, both due to the pandemic and the resulting financial impact on our university. During the past few weeks, we have been working closely with the leaders at all 4 universities and the system to address the short-term financial impact due to cuts in state support for fiscal year 20, and also longer-term financial impact from cuts that we are expecting from the state in fiscal year 21. Compounding the uncertainty is how the market is performing, obviously through our investments, but also the uncertainty that many universities face regarding enrollment for the fall. So the actions that we have taken and will continue to take include cuts to expenses, consolidations of units, elimination of programs, and beginning last week with layoffs and potential furloughs in the future. This will be a process that takes us well into fiscal year 21, and we have to be ready to both predict what's going to happen as well as to react to the scenarios changing very quickly. But throughout the process, we will be doing this in a way that is direct, transparent, and accountable. That we can promise you. Many of you have also asked us, how can you help during this crisis? And we thank you for your strong support, your commitment to the university, and the care that you have for the people that we serve in the state. I also want to thank especially Betsy Garrett, Rose Porter, and Bob Peefall for serving on the track committee to advocate uh, for programs that will benefit our current employees as well as those retired from the university. And your continuing advocacy will have such an impact when you share the positive contributions that we make to the community and to the state. So please continue with those advocacy efforts. Now, during times like this, questions are asked of us in terms of our commitment to excellence and commitment to programs that serve the mission of the university. We will continue to make investments in programs of excellence in student success, research, engagement, and inclusion to create a stronger university system that is founded with the foundational activities at the four universities. We also plan to have normal operations in the fall, but we will also prepare to pivot as soon as we can if the situation changes. So we hope to see you in your campuses for events in the fall. And in the meantime, please stay safe and share the good news about the positive developments at the university and how we are contributing to our local communities and to the state. So thank you very much for listening. And I look forward to having a dialogue with you along with my colleagues to answer your questions. Thank you. Marshall?
Thank you, President Choi. And again, we just thank our retirees, as you've already stated, for what they do for us every day in advocating and continue to support the great mission of the institution. Before we jump into your questions today, I want to take a moment and introduce our panelists who have joined us here alongside President Choi. Joining us today are Marcia Fisher, Associate Vice President for Human Resources and our Chief Human Resource Officer, Ryan Rapp, Vice President for Finance and our CFO for the University of Missouri System, Jessica Baker, Human Resource Director, and finally, Eric Vogelweide, our Comptroller. As a team, they'll answer many questions that have come in advance of today's town hall. And again, we want to thank you for the many questions you have sent in. Some of those questions, again, were very similar, so we have consolidated those so we can get to the heart of what you're interested in. So now let's get started. The first question will go back to President Choi and ask him this question. In response to the financial challenges caused by COVID-19 pandemic, what changes do you anticipate making in the organization of the University of Missouri System and on the four campuses?
So there are two parts to that question, and let me answer in those two parts. Each of the campuses have committees that are going to be established to help evaluate how to streamline the operation and to eliminate redundancies. This is a time when we need to look at program consolidation as well as program closures as we move forward. In addition to the changes that will be made at the campus level, we're also exploring further consolidation with the system office as well as the four campuses. And in addition to that, in terms of the system campus consolidation, the board is exploring the possibility of combining the role of president and MU chancellor, but to do it in a way that also empowers the chancellors at the three other campuses. So there's going to be a lot of work ahead, but it's going to be done in a very thoughtful and direct approach.
So as a follow-up to that, Dr. Choi, it sounds like that another question that come in, and I think you've kind of hit on this, that the system will survive, but it may look different in terms of organization and as an institution in MU. Is that correct?
That is correct. The system will survive. It has been in existence since 1963, and no one can argue with the success of the University of Missouri system and the four universities during those past 58 years. And we will continue to have strong collaboration that is created by having a system focused on excellence in the key mission areas of the university. So yes, the system will survive, but it may look different from the system that existed on March 1st, 2020.
Very good. And a final question for you, Dr. Choi, before we move on to some others. From a legislative and public funding perspective, are there plans to allocate the higher ed stimulus money not otherwise dedicated specifically to support students? Are there thoughts around that you may have?
Yes, and I believe CFO RAP can provide additional information, but the amount of funds that we receive from the stimulus, that the CARES Act, will be used at a allocation of 50% for student support, and the balance of it to basically address the budget shortfall that we have. The budget shortfall for the entire system, based on the cuts this year, this current fiscal year, totals about $37 million. On top of that, we've incurred $30 million in further expenses to provide refunds for students for dining and residence halls. So the amount of funds that we're going to receive from the CARES Act will not begin to cover the losses that we've already faced this current fiscal year.
Thank you, Dr. Choi. And now we'll look at some questions. And you already mentioned Ryan, and we're going to go to Ryan next and ask him some questions as our Chief Financial Officer. So I'll go back, Ryan. One of the things you stated at a recent board meeting was that when the COVID-19 crisis is over, we'll look at the state of pension and any necessary strategic actions that the board needs to take. What does this mean for the current and future retirees? Similarly, how does the current economic crisis impact the UM's pension benefit for both groups?
Yeah, so thank you, Marshall. I think I'll take the first part of that. And in reference, there is really what we were signaling is now is not the time for us to be looking at our investment strategy as it relates to the pension plan or our endowment. But we know when it becomes clear what the lasting impact to our investment portfolio is, we will have to spend time with our board. And one of the things we'll have to evaluate is the current discount rate we have, which is 7.2%. And, you know, as we look at that I would think, you know, we already pre-crisis were thinking that rate might have to come down. And as we get clarity on that, we will have to work with the board because the board does have to approve the change in that assumption. So that's really what I was referencing there is, you know, I don't think now is the time for us to be looking at that, but I do believe in the fall we will be. And as we think about the investment performance, I think when this all settles, we'll have our Chief Investment Officer, Tom Richards, spend time with this group. We have a balanced investment strategy, and we're actually seeing it work right now. We've certainly incurred losses, but some of the information Tom and I reviewed yesterday would indicate that we are performing better than other portfolios, you know, relatively speaking. And so, you know, we remain committed to the obligations that we have to our current retirees and our future retirees. So I think hopefully that gives some clarity as to what that was in reference to in the board report.
And you've already hit on one of the next questions that came in from some of our folks that were really interested. So I'll go to this part of it. Will the UM system continue to make regular annual contributions to the pension plan?
Yeah, so I want to be clear. I don't want to bore you with actuarial speak, but our pension plan, we have always made 100% of our annual required contribution, and we would plan to continue to do so. You know, I think there's certainly other pension plans across the country that have not done that, but that if we were to choose to do something like that, that would have to be a discussion that we would have with our board. And, you know, my concern with that is in many ways you're just kicking the can down the road by reducing that. So we have and plan to continue to make our annual required contribution to the pension plan.
And one of the questions that just came in too, Ryan, dealt with the 7.2% discount rate. And can you speak to that a little bit and what that means and clarify that for folks?
Yeah. So I think what that is that's the assumed investment return that the portfolio will earn. We've been coming down from 8%. We're now at 7.2%. And it's the expected return. And so if we earn less than that return, it increases the contributions. There's two sources of funding for a plan. One is our investment returns, and the other is our contributions. And so if our investment returns don't hit those assumptions, our contributions go up. And I've always said, even if we have if it's artificially too high, we still have to pay for it, because if we don't hit our assumed investment return, that just gets layered into the plan and we still have to pay for it. I would offer this. I think there's always tension between what that should be. And from a retiree's perspective, I would think, the lower that rate is, the better you should feel committing more funding to the retirement plan. But we also have to balance that with the mission of the university, because that more pressure on the operating cost of the university. And ultimately, the cost of the pension plan will not be driven by the return assumptions we use for the discount rate, but what the actual investment returns are.
Fair enough. Well, can you give our folks today a better sense of how university funds are invested, and does investment shortfall impact our pension benefits overall?
Yeah. So I think, falling short of our assumed investment returns, it impacts the unfunded liability. And so, I think when we see that happen, that then means there will be an increase to us. But we have a total return approach. Its emphasis is really on balanced growth. We're in equities, we're in fixed income, hedge funds, real estate, private equity, along with a risk balancing strategy. And I think today is not the time for us to go over that in detail, but when we do get clarity at the end of the year, I think it would be good to have our chief investment officer and myself sit down with the group and we can review the investment returns. We've done that with the retiree associations on a regular basis and would plan to continue to do so.
Yeah, well, obviously, folks are really interested in this topic, Ryan, and we're giving you a good workout now going through these questions. But one of the things that came up here, are there plans to reduce the retirees' annuities? And it sounds like that you're getting to that question, the heart of that. But just to make sure again that where you stand with that.
No, there's no plans to reduce the payments that we're obligated to provide to our retirees, whether it's their monthly pension checks or it's their annuities. Those are costs as a university that we're obligated to pay, and we would continue to do so. And I would offer, I've said this out pre-crisis, relatively speaking, we went into this crisis with one of the better funded pension plans in the country. And so, I think people should, I think that's something that certainly hasn't been done under my leadership. That's been done throughout the years. I think we've always had a conservative approach to our pension plan, and it's been well managed over the years, and we would plan to continue to do so.
Yeah, well, one of the other things people are really interested in, Ryan, and it deals with the same kind of issue, is that, as you know, there's a lot of rumors out there always, and one of those rumors we hear occasionally is that the university is either underfunded or borrowed money from the pension account. Is there any truth to that, or how does that work?
Well, I'll go back to, we have always made our annual contribution to the plan. So if they've said, we're not a plan that says, well, we're only going to make 85% of the annual required contribution, and that's set by our outside actuaries. And that really is set up to make sure that we can pay our beneficiaries and manage the plan appropriately. I think that question may stem from some things that were done in the early 2000s when the plan was overfunded. Really since that period of time, we haven't been in a position where we're dealing with an overfunded plan. And so the short answer to that is no, I don't think we've ever done that. And we certainly wouldn't intend to do so going forward.
So could you give our folks a sense of who manages our pension fund and how that was just one that came in?
Yeah. So our pension fund is overseen by our chief investment officer, Tom Richards. Then we have a investment advisory committee that is made up of outside individuals who mostly have ties to the university but are experts in the field of investments. We've actually been meeting with them every other week through the crisis to evaluate our strategy, and what we come away with is we are going to remain committed to our long-term strategy at this point in time. We're not contemplating any large shifts in the portfolio. What we will be doing at the September board meeting is reviewing our current asset allocation, and ultimately the board approves our investment strategy and asset allocation. And then Tom and his team work with our investment managers to execute on that strategy.
One of the things that people often ask, and this is certainly a valid question, is about endowments, and could we use those in a short-term situation? And I see maybe some clarification around how endowments are restricted or whatever. Maybe folks would like to know more about that.
Yeah, that's a great question. It's one that I think if endowments weren't restricted, just like our pension trust is restricted, I'm not sure it would be a wise thing to do, but I'm not sure it's even a possibility, because the majority of our endowments are restricted legally in their use. And it really only allows the earnings of those endowed funds to be spent. So we're not like, you do have some large privates who have large unrestricted endowments that they can direct towards any use. Now, that being said, even those unrestricted endowments, there's typically restrictions around using the corpus of those funds. And I think the other thing we have to be careful of is doing that is destroying wealth that has been built up over generations and really taking wealth from future generations.
So I want to go back to a question that was asked, or actually I asked Dr. Choi a little earlier about the CARES Act. And, what is that relationship? Can pension funding relief provided by the CARES Act apply to UM? And how can that be used together? I know there are certain stipulations that Dr. Choi mentioned earlier. You want to maybe hit on that a little bit more for folks?
Yeah, so one is, it is evident to us, and we are continually monitoring activity on the CARES Act. I think, that we see opportunities there, but I also think there's a lot evolving around that. So I'm not aware today, it doesn't mean it's not out there, of anything that is specifically related to pension plans in the CARES Act. What we do know is for the higher education portion, we are set up to receive approximately $34 million, but 50% of that goes directly to our students in the form of aid. And it has to be issued to our students in the form of a payment. So it's a direct payment to our students. We're largely just a flow-through recipient of that $17 million. It's to help our students. The remaining 50% can be used to offset things like President Choi referenced with the cost of refunding students' housing contracts. But again, that's only $17 million. As the president referenced, we're approaching close to $30 million just on housing refunds. So it is helpful. It certainly doesn't solve all of the challenges that we're facing.
One of the questions we often hear, and certainly it came in from one of our listeners today, is what protection would the retirees, in terms of university retirees, have against if the state was to declare some kind of bankruptcy or something like that? How does that affect something like we're talking about here?
Well, I think that would, I think we're a long ways from that being a possibility. I'd offer that the university's pension plan is not linked to the state's pension plan, and it doesn't receive funding directly from the state. And as I noted earlier, we remain committed to fully funding our contribution each year so that we can ensure our retirees continue to receive their benefit from the plan.
Well, Ryan, we're going to give you a break. I've given you. I feel like I've been on 60 Minutes here, and I'm on the moderator side of this thing. But Ryan, I want to thank you, because I know it's a lot to take in and a lot to process, and I know that you're willing to talk to people if they have questions. And certainly there are other questions I know have come in, and we'll try to get to some of those in a few moments. But we do want to go over and talk a little bit more about HR for a few minutes, and because there were quite a few questions on that area too, dealing with pensions and things of that nature. So I'm going to bring Jessica into this conversation. For those that have elected the guaranteed annual increase at the time of the retirement, will that continue?
That's a great question. We've been getting that question quite a bit. I can tell you yes. For those that are currently in payment, the payment option that you selected at retirement will continue. As an organization, we're always assessing the strategies to ensure that the liability remains manageable while maintaining our legal and regulatory commitments. So we continue to collaborate with TRAC, which President Choi mentioned earlier, with some retiree representation and university advisory groups, just to manage our assets in a prudent manner, both for you all that are receiving a benefit now, but for future retirees.
So as a follow-up to that, Jessica, is there an online resource whereby retirees can access a retirement statement to show projected distributions versus age, those kind of tools? Are they out there?
Yes, we have a very robust online pension calculator where individuals who haven't begun receiving a pension benefit yet can estimate what their future benefit would be. So we have that calculator available on our website or through MyHR. Our website at umsystem.edu/total rewards/retirement, and we will post that link in the chat for you. But another resource that's important to know is the retirement programs team. We've got a great team of individuals that are available to answer your questions. You can send an email at retirement@umsystem.edu to get your questions answered as well.
So how about if a retiree wanted to take a reduction in pension benefit during this time? Is there a way for them to do that to help out?
So we've actually had a number of retirees ask about this, and I just want to say we greatly appreciate the sentiment with that. It's really representative of the spirit of collaboration that is so important here at System Community. However, we have determined that a temporary pay reduction for retirees is just not something that we can do. But it's important to remember that retirees can always make a donation to the university, of course, if they are able and choose to do so.
And I just think, again, your point about that being such a great spirit that our people have and their willingness to help out and trying to find ways is very heartwarming, because so many people are in such a stressful point right now, career-wise and otherwise. So that's a wonderful question that came in. And again, I'm sure we can find ways, back to your point, that if they want to help out, we can find other ways they can do that. So we're gonna pivot now and go over to Marcia. I'm not gonna let her off the hook completely today. I got some great questions for Marcia to really go over and look at some of the issues that we're looking at in terms of healthcare and those kind of things. One of the questions that came in: will the current economic crisis impact health coverage and subsidies for retirees and their dependents?
Thank you, Marshall. And I do want to just give a little brag here to Jessica and her team, that if people do have retirement questions, that it really is a great team. And I know those that have interacted with her know that. And we also have a great benefits team that if there's any question, Carol Wilson is our director over benefits, and we're happy to dig deeper if we don't answer something today. But to get to that question, it's possible that we continually, on an annual basis, evaluate our benefit offerings. And we're continually to evaluate whether the investment's serving our community in the way that they want, and it's keeping costs manageable, both for the university and the employees and retirees. And even before this current economic situation, the cost of medical and pharmaceutical claims continued to rise. So we proactively evaluate plan design and cost, really just continually and on an annual basis. We've mentioned a few times now, and I want to as well, the Total Rewards Advisory Committee. I can't tell you what a helpful group that is. It's made up of faculty and staff and retirees, and they really dig into these issues with us and help make some of these decisions where there are tough decisions to make, pros and cons. And I just give a shout out to Rose Porter and Bob Pifo and Betsy Garrett, who are serving on that committee, and appreciate all that they do for us.
So another question that came in, Marcia, along the same line, will the university's financial situation change the insurance that they individually or their dependents receive in any way? And how likely would that be if it was true?
Again, that's possible. Every year we do evaluate, and there are changes that happen on an annual basis, and we take those to track and talk about them. And then they're also brought to the retirees, typically, I think around September or so, that we start talking about those. So yeah, there's likely to be changes, but that's not unusual. There's changes every year.
So the takeaway from that is that these changes occur anyway. It's not necessarily related to COVID-19, but certainly in light of the situation, there could be some different thoughts about things. But there is a process that I'm hearing about and a committee that looks at that, made up of, again, constituents of this group. So if you have ideas, we know who to call and who to certainly vet those through, it sounds like. So another question they had for you, going back to Jessica, is, again, this is a great question. When will we hear more about insurance changes for 2021 plan year, Jessica?
Great question. Every year we have a retiree annual enrollment period, just like we do for active employees. And typically in mid to late September, we communicate with all retirees covered by the plans and information about the dates of retiree annual enrollment, which are generally in late October, along with any changes to plan structure and also what the premiums are for the upcoming calendar year are all included in that information. So I would say keep an eye out and you'll hear about 2021 insurance premiums and changes in mid to late September.
Okay. Very good. And this is a question pivoting back over to Marcia. Will the tuition assistance and inexpensive parking be impacted for retirees?
So I can speak to the tuition assistance. There's no discussions right now to change that benefit. Parking, I think, is generally handled on the campus level. It's nothing that I'm aware of, but not something that I can speak to.
Yeah. We know the importance of parking, and that's an important issue. So I'm sure we'll get some more questions on that in terms of the campus issues that may come up. Another question that came in too, Marcia, was regarding library privileges that have been extended to retired faculty. You see that changing in any way?
That's another one I'd have to refer to the campus. It is campus specific. I've not heard any discussions about it, but campus would be the best place to find out about that.
Well, there's also been a lot of talk, and even I've heard some of this, about discussion of offering an early retirement incentive or severance. And I actually heard Dr. Choi speak the other day to this in a different setting. So any thoughts on that may be being looked at in terms of some type of early retirement incentive?
No, there's really not. That's not something that's being contemplated at this time.
Yeah. I think I heard Dr. Choi talk about the cost of that was to be prohibitive at this point. So again, great question, very insightful, and appreciate that. Another question we had was UM position on unemployment, and specifically if weren't to retire early, would UM agree not to contest the application in that situation?
So unemployment is decided by the state, not by the university. So we're not really in a position to be able to advise on that. I would say if people have questions about it, I refer them to the Missouri Department of Labor and Employment Security and encourage them to reach out and get additional information. And if they think that, we encourage people to apply if they think they might be eligible, but it's not a determination that we make.
Another question they had today, Marcia, in terms of your perspective and where you sit in the organization is, what is the Higher Education Recovery Task Force, and why is Missouri opting out of that particular task force?
So as I understand it, that's a task force that is for some southern states that Missouri is not allowed to participate or not part of that organization. So I'm not real familiar with it, except to know that it's not something that we're able to participate in.
Yeah, we had a few other things that have come in, and I'll just stay with you, Marcia. I think these are really relate to you. A couple questions here regarding we're in the final year of our contract with United Healthcare, and I'm curious as about what implications that may mean for retirees.
Mhm. So it's common that we periodically go out for an RFP so that we can make sure that we're still offering the best benefit at the best cost. So anytime that we do that, we're evaluating other carriers, and we'll see what happens. It's early in the stage now, so we'll keep people updated as we know more as that goes along.
Well, thank you. I know that'll be of high interest. And another question that has come in too, and this would go back to Ryan, I think. Ryan, could you give us folks a sense of what the pension fund is worth, what its total value is?
Yeah, it's the current value of the pension plan is approximately 3.8 billion. I've shared it with the retirement committee in the past, and we continue to publish it. I think Kelly sent a link to the group, but we do publish our quarterly investment reports, and they can go look at that, and it's got that type of information along with the type of assets that the plan is invested in, and also includes the funded status of the plan as well. So if you have more questions on that, I think the March 2020 report is currently out on the website, and you can see what the returns have looked like over time as well.
All right, very good. Well, Dr. Choi, we had a couple questions come in for you, so I'm going to pitch it back to you for a couple questions that came in. One of them is more of a generic question. People are really interested in what student enrollment looks like for the fall, and I think not only at MU, but across the whole system, obviously. And then also in this time of COVID-19, how do you think grant-funded programs are going to be affected? Obviously, faculty are really interested in that. Many of these are retired faculty, and they'd be really interested in how that might be impacted at the federal level, perhaps.
Okay, so we are monitoring the enrollment for freshmen and as well as transfer students on a weekly basis. And those numbers look very positive. With the exception of UMSL, all three campuses are showing increases in those areas, which is very positive. We are also taking into account those students who accepted our offer, but also since then have sent in a notice of cancellation. So even with the cancellations, we are ahead. We're also measuring the return of students or returning students and their enrollment. And I only have the data for Mizzou. We're requesting data from the other campuses, but Mizzou's returning student numbers look about 300 students higher than last year. And part of the reason that we're seeing the strong demand for enrollment is, high school students who've not been in class for the past few months want to come to college. And those students who are continuing students are getting a little bit of cabin fever, and they want to come back to college. So we are seeing that. But it may change quickly if we find that there is a resurgence in the state. But all indications are that we are on the downward trend when it comes to the number of cases and deaths in the state. So we are in much better shape than many universities that are in larger cities or on the coast. So we're preparing for a full open, being mindful of health and safety measures, but we are planning for a full open at all 4 universities.
How do you see, again, going back to another question that came in terms of grant-funded programs and also clinical research, do you see that being impacted any way during this time?
Well, it has taken a very big hit because our researchers were not able to get back into the laboratories. So they've been very creative doing their work remotely, but it's difficult to do laboratory work remotely. And so beginning early next week, we're going to be sharing information to our faculty researchers to make a request to come back and do their essential work. And that'll be reviewed so that faculty can return with their graduate students and staff beginning in May 20th, next Wednesday, with the proper precautions that they need to take into account.
One of the things that came in too, Dr. Choi, and I know I've heard you talk about this and related, is about the impact of telehealth. And we're seeing that really change the game in terms of how we reach out to people and how MU Healthcare does that. And the exact question was, how do you think telehealth will impact retirees in terms of reaching out and helping them with their health care, maybe driving down some costs? But I think it'd really be good for them to hear some of that background, the data that you've picked up on, and how many more people are using it as well.
Yes, telehealth is now the primary way that we are interacting with patients. Now that would change because we're going to have more activity in the hospital as we see the pandemic winding down in Missouri. The stat that Jonathan Curtright shared is that during the past year, the number of telemedicine visits, I think, totaled at most 200.
That's right.
200. But now they're regularly seeing 1,000 patients a day. And so many of the docs who perhaps discounted the effectiveness of telemedicine are now seeing that it can be effective. It doesn't replace the physical examination and so forth, but it gives a way for us to reach residents where they are, reach the patients where they are. And it does help to reduce the cost of medicine, which will benefit the state and the nation.
Yeah, I know that personally, I can tell you I used it myself. So I know it works. And so I'm an endorsement for that. I'd never used it before. And it is a powerful tool, and it's so easy to get to use there. Another question that came in for you, Dr. Choi, deals with engaging students who perhaps are worried or concerned financially about coming back, and maybe there's a little bit of drag there. And also a piece of that would be the international community, the international students. Maybe you want to touch on those two.
Yes, our universities have been reaching out to all of our students who are continuing students, as well as freshmen and transfer students who've accepted our offer. And we're finding that students have questions about their financial ability to make the payments for the university, for their education. And so our team has been very proactive in reaching out to those students who may have had a hold on their ability to re-enroll, and sharing with them the possibilities of using care funds to be able to lift those holds and to register them, and based on the means testing, to provide them with more financial aid going into the future. So we've been very proactive in that regard. Many of our international students are still on campus, whether they are living in our residence halls or in surrounding apartments near the campuses. And our directors of global affairs have been very proactive in reaching out to them to meet their needs. And we know that it's difficult for them to be so far away from home and to address this pandemic on their own, but they know that we are behind them and we're here to support.
Very good. We did have another question come in for Marcia and or Jessica, and not to let them off the hook that easy. What factors will drive the selection of the next healthcare provider as that decision is made?
So really, when you put out an RFP, there's a number of factors that, and usually we have a group of people that are helping to develop that. But it's looking for value, which is a number of factors related to the quality of what can be provided. And of course, cost is one factor. Jessica, if there's anything you'd like to add on that?
I'd say we always look at, we go to bid about every 3 years for a medical provider, and we do look at what disruption would result of changing providers. That's very important. And plan design. We take all of those things into account, and administrative support that the vendor would provide, and how they work with our teams and things like that in the university as a whole.
Very good. I knew we wouldn't let Ryan off this easy. So Ryan, we got another question for you dealing with pensions. For current employees, do the new pay cuts and reductions how does that affect their calculations or their retirement? And so, or will it be a pre-cut pay, or how does that work if somebody takes a reduction or is in a position where they have to have a reduction in pay?
So I'll give a high level answer, and then maybe Eric can provide a more detailed answer. It's based on the average of your high five. For the period of time you take a reduction in pay, it will reduce that. Now, I don't know if that would actually impact the average of their high five years, but for the period of time people take a reduction in pay, it will have an impact.
Eric, do you want to add anything to that?
No, that's correct. So any reduction that is applied to individuals' pay, even the voluntaries, will reduce the salary. And if that's one of their high 5 years, it will in effect reduce the future payment.
Okay, fair enough. This is another question going back over to Dr. Choi again. And this deals with program reviews, which have been certainly talked about recently in the last couple of weeks, quite often in the media, as we put out a lot of information around that. So the question is about duplicate programs that you see on various campuses like law or medicine. Do you foresee combining these programs into one campus, or do you have any thoughts early on of what that might mean?
So I would say at this point, everything is up for discussion. But what is different for this period compared to other periods in which such consolidations have been contemplated is both the urgency of the need and the magnitude of the financial challenges that we're going to be facing. Now, for the person that asked that question, and I know what the motivations are. If there are two duplicate programs, why should we continue to support the administration that leads those programs? Why not combine it? It's not always as simple as that, because we have to ask ourselves, what is the value of having those two university, let's say law schools or two medical schools? And does combining it make financial sense, but also does it support our mission? And so those questions will be asked. But before we venture into too many system level consolidations, the leaders at each campuses must make a concerted effort to consolidate where they can in their own campuses. So whether it's eliminating colleges that no longer meet the mission of the university, and perhaps those colleges can be consolidated with other colleges. And that helps to save with the administration costs, but also it may better meet the mission of the university. And so all of those options will be discussed at the campuses as well as across the system.
I think it's fair enough to say, Dr. Choi, and to all of our panelists, that we are in a time of tremendous opportunity, a tremendous challenge. Opportunity often is found in challenge. And so I think I want to go back to something that was said earlier in this conversation regarding the need for our retirees to continue to join with us on advocacy. And Dr. Choi, do you want to take that again and talk about what they can do to be helpful and to help us think through these processes, as well as share the good news of the university, perhaps?
And that advocacy is so important. But let me go back to program consolidation. I just learned today that University of Akron will eliminate 6 colleges, and they're going to make a decision within the next few weeks. We're not going to make decisions within the next few weeks about massive consolidations, because I believe, and we all believe as senior leaders, that we need to have a discussion at the campus level and across the system so that we do it in a thoughtful way to make sure that we are considering unintended consequences of our actions. In terms of advocacy, many of our retirees are already doing that very effectively. They're sharing with their neighbors, with their elected leaders about the value, whether it's UMKC serving the needs of the city of Kansas City in both addressing the disparities in education as well as health, or those in St. Louis addressing the mental health needs, especially during this crisis, but also the opioid addiction that afflicts that city as well as many communities in St. Louis. And Rolla has really stepped up in using their engineering expertise to develop personal protective equipment for surrounding hospitals. And here in Columbia, with the work that you do, Marshall, through engagement to ensure that the citizens throughout the state have access to the educational and health programs that are developed at this university have been so helpful. And for all of our retirees, if you can share those positive messages with your friends, with your elected officials, especially during this period when we are being evaluated, or our budget by the state is being reevaluated, will be very, very helpful. At the same time, tell us what the concerns are about retirees. We are very open to suggestions. We're very open to criticism. And we take those opportunities to reflect on what we're to determine how we can do better. So continue with the advocacy as well as letting us know how we can do better, do our jobs.
Well, thank you, Dr. Choi, and I'm going to bring this conversation today to a close. There's other questions that have come in, and we're going to make sure we get all those answered and put out there. We can't get to everybody today, but clearly we've given a broad brush of a lot of things and tried to give you a sense of the confidence I hope that people are looking for from this team that is out there. And I do want to thank all of our panelists and our communications team, who is so important to putting these kind of things together. It's also important that you remember that we're going to be posting this online. Sure that, again, any questions that came in we didn't get to, or if there was a nuance in a question that maybe we didn't answer exactly, get to the way that you were looking for in terms of the context of the question, don't hesitate at all to reach out and let us know that, and we'll make sure we get those in there as well. There have been some questions to us recently about another town hall opportunity. We hope to continue to do these regularly, and I think it's Dr. Choi's desire to continue to communicate in this way if this is helpful. And so again, your feedback on this is really important, whether it be in this setting or whatever settings as COVID-19 unfolds that we're able to do. We as a university want to stay connected with you, and that's really important in our work. It's important in our collective work to serve Missourians, the nation, and the world. So again, if there's ways that we can do better in this process, we appreciate that. We do want you to know that if you have specific questions that deal with today's content related to particular the things that our panelists talked about in terms of finance and HR, we want you to reach out to HR Service Center. That's HR Service Center at umsystem.edu. HR Service Center at umsystem.edu. Now with that, I'm going to turn it back to Dr. Choi to conclude today's session. Dr. Choi?
Thank you, Marshall. And I enjoyed listening to all of your questions and the answers that the team that's been assembled has been able to provide. During this period, we are thinking about you and your health and those of your family and friends. Stay healthy, stay resilient, and stay committed to the goals that we have at the university. And your support is greatly appreciated. And we hope to see all of you in person very soon. I can't wait to start interacting with people, not through Zoom, but in real life. So thank you and take good care.